Hi, my name is Melanie, and we're going to be discussing the Tina Jones simulations that we did. Throughout the simulations, there was a significant amount of repetition. While I understand the importance of completing critical elements consistently, I think that repeatedly reassessing areas that we've already done and have already reevaluated felt very time-consuming and sometimes dull. Participating in the simulation sometimes felt more like a lengthy online task than engaging in an interactive learning activity. And the most challenging aspect was the 30-second delay between each interaction, which disrupted the flow state that I was in while completing these assignments, honestly. I did appreciate the critical elements in these assignments. I thought that the opportunity to practice the critical elements were very useful, and they followed proper protocols, including scanning the patient's armband before giving them the medication, and it reinforced the importance of patient safety and adherence to established procedures. However, from practicing as an RN, I don't think that it fully captured the experience and realities of what a clinical setting would actually be. Simulations often present perfect scenarios, and unfortunately that's not what it's going to be in the real life world. So there's only so much you can really do. In the future, I would follow appropriate protocols as simulation instructed us to do, and facility policies and evidence-based practices that have been taught throughout nursing education. And some of the concepts reinforced during the simulation can be applied to clinical practice, particularly to patient assessment. I do think that I would use what I've learned from these simulations in the clinical setting. Overall, it was a great experience, but just very time consuming as a student. I would appreciate more clinical time with patients rather than a simulation. Thank you.